Most of the cases in school-aged children are from different year groups and across a range of schools. The evidence suggests that transmission among schoolgoers is happening outside of the school setting, at parties, at sports events, but not necessarily in the school itself. And also as a result of the school-age cases related to the community outbreak that we reported on earlier this month. Public Health Gibraltar and the Contact Tracing Bureau are working with the Department of Education to identify close contacts. The school's vaccination program for 12 to 15-year-olds started this week, meaning that children who've been recorded in the official statistics so far would have contracted the virus and been in the incubation period before being offered the vaccine. After anyone has tested positive for COVID-19, there's a minimum window of 4 weeks before they can be offered a jab. The Director of Public Health says an increase in cases was anticipated after the change in self-isolation policy on the 30th of September, and it's not a cause for concern at this time. Dr. Helen Carter said the increased testing among people of a school age ahead of the midterm break could also account for the increased number of cases that we've seen in recent days. In any case, she's reminded us that the cases of COVID among children still tend to be mild. Dr. Carter says there's been a strong uptake of the offer of vaccination for 12 to 15-year-olds. And remember, public health advice remains that if you have any of the COVID-19 symptoms, you should isolate immediately. You should call 111, book yourself in for a swab, and until you get a negative result back, you need to avoid mixing with others.